Good morning, Houston, and welcome to Feeling Better Naturally with Dr. John Trowbridge, here on Star 790 KBME for the best medical updates ever. Each Saturday from 6 to 7 a.m., we'll share with you practical preventive medicine, steps that you can take starting right away to regain and maintain better health. Each week, we'll update you on books you need to read. We'll update you on what you need to know to stay healthier. We'll share interviews with patients and experts. So get your pen and paper ready now so you won't miss ideas that you want to remember. We'll be talking about what you can do to get out of your pain and get on with your life. I've researched and practiced here in Metro Houston for 25 years, never believing that you're suffering from a deficiency of one or more drugs or that an operation is probably the best answer. Whatever ails you, God built your system to repair itself and to restore more normal function. And that, in a nutshell, is the whole buzz on the topic of alternative or holistic medicine that you've been hearing about these past few years. Drugs and surgery can be helpful, but true natural healing depends on three factors. First, find out what's blocking you from feeling better and remove it. And second, find what trace factors you might be missing but you need for repair and provide them. And third, find what switches need to be turned on, then turn them on. We'll share practical pointers to help you improve with the most common problems seen in doctors' offices. Practical preventive medicine updates to help reduce your risk factors for the most serious diseases that claim our comfort and then our lives. And practical ways to reduce your risks and improve your results with drugs and surgery that you might need. As I've said for years, when life is your choice, failure is not an option. So learn more today on how you can succeed. The book of Ecclesiastes tells us in chapter 1, verse 9, that there is no new thing under the sun. So let's see what we might learn from those who've walked the path ahead of us. A wonderful quote from Albert Einstein, one of the great thinkers of the 20th century. Truth is what stands the test of experience. And indeed, when we talk about the test of experience, what we mean is what really works, what keeps working, what is what's real. And a very simple way to say it, truth is what stands the test of experience. Today we'll talk about a very interesting problem that so many people are suffering with. Ron from Alvin called to ask me to better explain arthritis, especially that's coming in middle age or older age from sports injuries when younger. Now, the kind of arthritis that we're talking about is osteoarthritis. And it's the most common type. It's sometimes called degenerative joint disease. It affects both men and women. It affects mostly the fingers, the knees, the hips, the feet, and the back, but it can be any joint, shoulders, elbows, and so on. Osteoarthritis results when cartilage in joints begins to break down. Now think of it this way. The ends of bones come together and they have kind of a slick saran wrap type surface. And then someone puts cooking oil in between the saran wrap surfaces and they slide and glide. And if someone throws sand in the cooking oil, that starts to carve up the saran wrapping. And when you carve that up, it's very uncomfortable. The body responds to it with pain. That breakdown of cartilage is kind of a wear and tear problem. It's obviously worsened when you're heavier, so obesity is a risk factor. But joint injuries are certainly the major problem. And what that means is two bones come together, but they don't interlock. They are held in position by supporting tissues, and those are called ligaments and capsule. And then the muscles pass over with what's called a tendon to attach one bone to another so that it can be moved. And these all support the joint in place, unless, of course, you sprain it. So a sprain or a strain is a significant pull or stretch, sometimes even tearing, of those supporting structures. And that's what allows then the joint, instead of freely moving back and forth in its normal range, it allows it to wobble. And when it's wobbling, that creates the problem associated with osteoarthritis, because when your body detects this wobble, it says something is wrong. And in saying something's wrong, it doesn't have enough blood flow to those supporting structures to regrow them. That's why a joint that gets sprained at one time, like an ankle, is the one more likely to get sprained the next time because it's weaker. The support tissues cannot have good blood flow because they're called upon to become taut, to become firm when they're stretched to an extreme. And if you had good blood flow, good blood vessels in those supporting tissues, you would be bruising all the time. You'd be tearing those blood vessels open. So blood flow is what is required for healing. And if you don't have the blood flow in the area, then the healing will be limited. So ligaments and tendons, joint capsules, and so on, will heal less well than other tissues of the body. And that's the problem. Those support tissues then that have been stretched and torn stay stretched and torn, allowing the wobble on the joint. And the only alternative that your body has is to make little spurs that are an attempt to fuse one bone to the next. Now, you'd end up a stick person because that joint would no longer be able to move, but it would stop the wobble. And that's the idea that the body is aiming at. Now, various forms of arthritis affect more than 15% of the American population. That's over 43 million people. And it's more than 20% of the adults. So this makes arthritis one of the most common conditions in the United States. And it is, of course, a leading cause of disability. Everybody who's got that knows what disability means. It limits your major activities like working and housekeeping and school and so on. And that does so for about 3% of the American population. That's 7 million people. And arthritis trails only heart disease as a cause of work disability. It's a chronic pain condition, so it has a negative effect on a person's mental health. And of course, as people are in pain, they reach for a variety of painkillers, pain control, and that can lead certainly to drug addiction problems. It can lead to overuse problems where people are taking things beyond what the prescribed amount is. It can also lead to drug combination problems when they find that mixing two drugs together seems to work better than one alone, or mixing a drug with alcohol works better. It also means that they're taking a lot of non-steroidal anti-inflammatory medications. And those are the ones that you get over the counter that are not Tylenol, but more like aspirin and, the common brand names for ibuprofen and so on. These drugs, aspirin and the non-steroidal anti-inflammatory medications, can cause significant irritation to the lining in your stomach. And that means that you can have bleeding. And indeed, there are numbers of people with significant bleeding side effects that limit their life and their future, because that is a serious complication. One of the reasons I got into alternative approaches in medicine to integrate what I do with what else can be done is because of a prescription that I gave a patient in my first year of practice. He was in his early 50s, had significant arthritis, and what happened was pretty unfortunate. He had dramatic control with his arthritis pains. It's a drug called naproxen. That was a prescription at that time. And I was called to the intensive care unit, and we could not put blood into him fast enough in order to stop the bleeding that was happening in his stomach, and we couldn't get him stabilized for surgery. He literally died right there in front of me. And that had a great impact on me, and I decided that if I were going to stay in the practice of medicine, it was going to have to be much, much safer for patients. And now that drug, incidentally, is available over the counter. And when you seek relief with Aleve, please remember my story. So today, we're going to be talking with a couple of patients who have had significant arthritis associated with sports injuries in the past. And those two fellows have a wonderful history to explain because they've returned to national champion level performance. Lest you think that what we're talking about is something that's way out or something that's really unavailable, I'd like to just tell you a couple of stories from Muscle and Fitness magazine, a story published in their January 2002 issue. Johnny Morton, a wide receiver for the Detroit Lions, was having pains down just at the top of his left buttock where muscle pull was a problem, and also pain in his left thumb. And he was treated in Los Angeles by a physician doing a technique similar to this reconstructive therapy, or RT is what we call it. It's a non-surgical treatment. And he got such good relief, he recommended David Sloan, a tight end with the Detroit Lions, one of his good friends, who had a severe toe injury that just wouldn't get better. And these two gentlemen have had such wonderful relief They speak enthusiastically about a non-surgical approach for getting better. And that's what we're going to talk about today. So we're talking about major sports heroes, major sports performance, and that's where we'll go from here. The time is about 10 minutes past the hour, and you're listening to Feeling Better Naturally with Dr. John Trowbridge on Star 790 KBME, the best medical updates ever. Your extended health forecast is brought to you now by Life Celebrating Health in Humble, near Bush Intercontinental Airport. Our crystal ball shows clear to partly cloudy, and the winds of change are blowing. If you're choosing to make changes to regain and maintain better health, sunny skies are coming your way. If you don't know what you can do, or if you're not changing anything and simply hoping for the best because you've been feeling good, no problems, then partly cloudy to stormy skies are on your horizon. At Life Celebrating Health, you can depend on us as partners in your health care, and we'll design personalized programs to help keep your days sunny. Call for a telephone consultation with one of our treatment assistants. No fee, no obligation. Just dial 1-800-FIX-PAIN. That's 1-800-FIX-PAIN, 1-800-FIX-PAIN, and ask to receive our free e-newsletter. Just share with us your email address or send your questions to us through our internet website, www.healthchoicesnow.com, because unlike the weather, you do have choices for better health. Now, as I said, I was going to bring you two patients today who have national champion level performance. We're joined first by Mark Grunland from Umatilla, Florida, who is a water skier, a sport obviously of interest to Houstonians. Mark, thanks for joining us today.
Good morning.
Good morning. So you came to me with a very interesting story about a very severe injury.
You're right. I had a devastating injury about 10 years ago. It was in the fall of 1992. I'd been training for 3 years to go into a new skiing division, and I skied in two record-rated tournaments and just exceeded all of my expectations. Training to go into a third one right before the winter season set in, and a terrible accident happened, and I sustained an ankle injury that, I thought it was going to set me back for a month or two, and as it turned out to be a rather significant injury that a number of doctors had informed me that it was a career-ending injury. So it was a startling to me.
That for a skier who is at your level is not what you want to hear.
No. At that time when I sustained that injury, I was 35 years old, and in the sport of competitive water skiing, that's actually a person's peak age. And
here you are hobbling on crutches.
I wasn't hobbling very well.
Okay.
But anyway, when I sustained this injury, I wasn't able to walk. I wasn't able to put any kind of weight on my foot. So I went through the typical routine of calling my family physician, and I went down and spoke with him, and he sent me off to get the X-rays, and I did that, and they didn't see any broken bones in there, so they said, well, just give it some time, and so he, in turn, he sent me off to an orthopedic surgeon, and he wiggled my ankle around a little bit and noticed how swollen up it was, and he felt as though I stepped off of a curb and twisted my ankle.
So just a sprain or a strain.
Yeah, but once I explained to him that I hit a buoy skiing at about 60 miles an hour with a 5-foot lever hooked onto my foot, he didn't quite understand the speed portion of it. But again, what he told me to do, and this is a man well experienced in orthopedics, is me to go down and get a bunch of Advil and take those.
That's a non-steroidal anti-inflammatory.
Okay, and he also mentioned to me that at my age I shouldn't be skiing anymore, that I'm far too old to be involved in an activity like that. So anyway, here's two doctors that I've talked to, and they both told me that I shouldn't be skiing anymore. And so I went to another friend who's a doctor, who's a well-known orthopedic surgeon, and he's quite versed in dealing with the U.S. water ski team and those athletes. And he requested that we had a bone scan taken and a few other tests. And after a review of those tests, he kind of came up with the same kind of an outlook for me. He thought that I did have a substantial injury. He didn't think that it required surgery, but again, he told me to just lay off the skiing and let Mother Nature take its course and see what the outcome was going to be.
Now, all this time, you're still suffering.
I'm still unable to walk without a significant limp. Just absolutely devastated because, for prior to that time, about 17 years of my life has been devoted to training and, to ski and competition.
Right.
So that's 3 doctors down. One of my training partners was a rather interesting person. He sold replacement joints, I guess you might call, for the orthopedic surgeons who do the joint replacements, the knees, the hips, those sort of parts. And he put me in touch with an ankle specialist. Now, this man was a orthopedic surgeon in Orlando, Florida, supposedly the best ankle surgeon anywhere around. Well, after a lengthy battle with my insurance company, I was able to go see him. And we did a second MRI, and we found a very interesting injury to that ankle joint, one that they call a vascular necrosis, which is as you could probably explain better, is when that bone tissue dies that's in the joint.
That's substantially more than a sprain or a strain.
Significantly more. So we scheduled a surgery. There were a couple of the major ankle ligaments that were completely ruptured that needed to be repaired. There was a bone chip that was lodged in the side of my ankle that was the size of a pea, and then this avascular necrosis, which that's the same thing that ended Bo Jackson's career.
Exactly.
The famous football and baseball player. So now that we find out what this problem is that I've got, now I'm really devastated. This ended Bo Jackson's career, so it's likely it's going to end mine also.
Pretty bleak future looking there.
Yeah, 35 years old for a young man who's at the top of his game. So we went ahead and we did this operation on my ankle. And what this doctor did was he went in and he had to, first he repaired the ligaments, but when he got into the joint itself that had the damage, and he compared that injury to one jumping off of a 3-story building onto a concrete pad.
Ouch.
That the cartilage tissue was just all shot. The bone damage to the actual joint was devastated. So what he had to do was go in there, remove all that old cartilage, and remove all of that dead bone material that was, at this point, was beginning to spread through that entire bone. So after the whole operation, the surgeon gave me this news. He says, "Mark, that injury was so bad," he says, "within 6 months, we're going to have to screw that ankle joint together.
Fuse it
together."
Mm-hmm.
So we went through the basic.
What did he say about further skiing?
Oh, he said that your skiing would be extremely limited at that point. I mean,
competition days are over.
You might as well just forget that.
Right.
So we went through the rehabilitation, the stretching and strengthening, the typical rehabilitation movements that we do. And then I had one of my initial training partners, a chiropractor by the name of Dr. Wetz, who's also from Humble, Texas. gave me a call, and he knew of this injury that I had because I had hobbled into his office one day.
Mark, I'm going to ask you to hold that thought. We're going to pause briefly for this announcement. It's now 20 past the hour here on Star 790 KBME with the best medical updates ever. You know, if you really want to influence a child's life, wear your seatbelt. Research shows that when a driver doesn't wear a seatbelt, 70% of the time the children in that car don't either. An unbuckled child is in danger, and automobile crashes are the leading cause of death for children. Help us stop unbuckled adults from endangering children's lives. Please, buckle up, Texas. There's just too much to lose. This has been a public service announcement brought to you by Feeling Better Naturally with Dr. John Trowbridge and Buckle Up, Texas. And just a brief reminder, if you're born between November 22nd and December 21st, you're a Sagittarius, for whatever that means. And December birthstones are blue topaz or turquoise or lapis lazuli. Maybe that gives you some Christmas gift ideas. All right, Mark, we're back to how you found out about non-surgical repair with reconstructive therapy.
Well, this is the most exciting part, is I have a doctor friend who actually knows water skiing. He was a national champion water skier, very familiar with the injury that I sustained, and he called me and he said, "Mark, I think I've got a guy who can help you." Now I've got to say, after what I'd been through for the last year, this is the best news I've heard.
Were you skeptical?
I had a lot of faith in my friend.
Okay, that's a good point.
I knew that if he was willing to tell me about this special treatment, that there was hope. So what I did was I did a little bit of research on it, and I actually did something that most people might not. Was I called you.
Right.
I called you and I explained to you the predicament that I was in, and I said, "Look, this doctor who did the surgery on me hasn't given me much of an outlook on life." I said, "Can you help me?" And your response was, "I think I can." So I think I got on the phone and I made plans to come to Houston that day, or it was the next day. And what I did, I came and I began those treatments on my ankle. And the interesting thing was I brought my water ski with me. Not anticipating that I would actually get to water ski, but once I started those treatments, that reconstructive therapy on that ankle joint, that ankle started getting better daily. And I think it was about the 6th day of the treatment, I started going to the lake after I left your office.
That's right.
And I started skiing again. And after the 10th treatment, I started running. I was running a couple miles a day, and I could actually feel that ankle getting better by the day.
Now, weren't you worried about running on an ankle that's going to have to be screwed and fused together?
Well, I was, but I'm an athlete, and my entire life has been built around training, and I believe that those parts have to move. I don't believe in laying on a couch and waiting for things to get better.
That's exactly right. We tell people, don't be a couch potato while you're going through this. We want you moving, and that provokes what's still a problem, so we know where to direct the treatment.
So that's exactly what I did. I would do the treatments, and I also had a special ankle exerciser machine that I was going through this regimen 2 times a day, which was strengthening the ankle and getting range of motion going at the same time. And by golly, that ankle was getting a lot better. So I did those treatments for, I believe it was a 2-week period. And I came back to Florida, and I trained for 2 months, skiing almost every day. And I went back out to Houston for 2 more weeks, and I was getting those treatments done again. And at the end of that second 2-week session of treatments, I was walking without a limp. And I was continuing to go in to see my orthopedic surgeon who did the surgery. And this is really interesting because he gave me 6 months max before we were going to have to screw that ankle joint together.
Right.
And I would go in and we would take an x-ray every time I went back to his office for a follow-up. And he was baffled that the sequence of x-rays that we took on that ankle joint, the thickness between the two bones where the damage was, the thickness between those two bones was increasing with every x-ray we took, meaning that that cartilage tissue, which was damaged, was regrowing and thickening. Now,
that's kind of nice, isn't it?
At that time, doctors were saying that you can't regrow cartilage.
Right.
Okay. Now, he never did ask me what I was doing to make that cartilage regrow, but he did make this comment. He said, "Mark, I don't know what it is that you're doing, but whatever it is, keep doing it, because what's happening in that joint isn't supposed to be happening." Now, I took that to be a pretty significant statement that he made.
Sure, because, our point of view is that it is what's supposed to be happening. That's the natural healing that God gave us the instructions for on the inside.
It is. So I'm a believer that the reconstructive therapy will increase and strengthen the joints in the body. Now, the story about my ankle is just a great story, but it doesn't stop there. I've been seeing you now for 10 years, and I think I've had you treat just about every joint I have. I've had you work on my back and my neck and my knees, and this treatment works on every joint.
It sure does, and it keeps you prepared for optimal performance.
So I am so convinced that what you do works that I have taken it to the next level, where I actually have you work on areas of my body that traditionally wear out on water skiers.
Right.
Such as the
before
knees,
they wear out on you.
The knees, the ankles, and the lower back. So now I'm 46 years old. I haven't had that ankle fusion yet that I was supposed to have, I think, 9 years ago.
Right.
But now I'm skiing better than ever. I'm skiing better than before I got hurt in 10 years ago.
Mark, we say that RT, reconstructive therapy, can actually make you stronger than you were before you got injured.
I absolutely believe in that. I believe that wholeheartedly. I mean, I'm 46, and most 46-year-old men don't hit ski jumps going 60 miles an hour.
And land how far down?
150, 160 feet.
That's pretty good.
That's pretty good.
Yeah.
But interesting thing is a lot of the people that I've competed with and skied with over the years have kind of faded out of the sport.
Well, they got hurt.
They got hurt. Their bodies have worn out. And I'm proud to say I'm still going strong. I feel as good now as when I was 30 years old.
That's excellent. And you still score points.
I'm still skiing great. I'm skiing at a national caliber level, training daily. My favorite event is jumping, which is traditionally the hardest one on your body, especially on your knees and your ankles. And but the X-rays that have been taken of my ankle over the last 10 years have shown, and it's proof, that the treatment that you have done, the reconstructive therapy treatment, will regrow that cartilage tissue. I have no pain whatsoever in that ankle joint. I have full range of motion, no pain. I'm not limited whatsoever, and it's just I don't want to say it's a miracle.
It is. It's the miracle of healing,
But what it is I found you, and you have something that works that is different from the traditional methods. Now, if I had never found you and the reconstructive therapy treatment, I would probably, at this point in my life, be addicted to pain reliever drugs, probably wouldn't be skiing at all, and have been retired to some sort of a passive exercise program. So I'm absolutely tickled and convinced that the reconstructive therapy works. I've had a couple little minor injuries to a hip, to some joints in my fingers that have bothered me and nagged me for months. And just from one treatment, one simple treatment on one of those areas, completely all the pain is gone.
That's absolutely marvelous. Mark, we thank you for sharing your story with us today, and we'll look forward to seeing you again in Houston. Thanks a whole bunch. And it's now about 30 minutes past the hour here on Star 790 KBME, the best medical updates ever. Sometimes, especially when our attention is focused on our health problems, we forget that laughter is the best medicine. So let's try this one for size. An old fellow came into the hospital truly on death's door due to an infected gallbladder, and the surgeon who removed the gallbladder was adamant that his patients be up and walking in the hall the day after surgery to help prevent blood clots forming in the leg veins. The nurses walked the patient in the hall as ordered, and after the third day, the nurse told how he complained bitterly each time they did. The surgeon told him to keep walking him. After a week, the patient was ready to go home. His family came to pick him up, thanked the surgeon profusely for what he had done for their father. The surgeon was pleased and appreciated the thanks, but told them that it was really a simple operation and we'd been lucky to get to him in time. "But doctor, you don't understand," they said. "Dad hasn't walked in over a year." Incidentally, this next week is National Hand Washing Awareness Week. Now, does that sound like a joke? But, many diseases are spread by hand-to-hand contact or hand-to-mouth contact, and that's what doctors are supposed to be, washing their hands between patients. You ever wonder about those signs in the restroom that say all employees to wash their hands before returning to work? You wonder why the health department thinks that they need a reminder. Shouldn't everybody kind of know that? I'd like to remind you how much the show depends on you to share your questions and ideas with me. What topics do you want to learn more about? Over the past 24 years, I've developed and improved integrative treatment programs to help many people suffering with frustrating illnesses: fibromyalgia, chronic fatigue, migraines, other headaches, rheumatoid arthritis and lupus, hypoglycemia, diabetes, heart disease, even after surgery, and especially congestive heart failure, shortness of breath, poor circulation and leg pains, decreased memory, ulcerative colitis and other gut problems, frustrating skin conditions and disabling neck and back pains, and as we've discussed with Mark, sports injuries and arthritis and so on. What disease problems would you like to know more about, and what books do you want me to review? Many of the leading authors and newsletter editors in preventive medicine have been personal friends of mine for years, so what questions do you want to have them answer? I'll be presenting common problems that are seen in doctors' offices, which are the very reasons why you make office visits, and giving you practical hints on how you can take better care of yourself for best results. In my 25 years of practice, I've become acutely aware that very few people know that simple, effective, and cost-conscious solutions are available to help with their problems. And few people realize that several of the problems for which they are seeing different specialists are often related to the same cause. For example, magnesium deficiency can show as anxiety or insomnia and restless sleep, arthritis, pains, constipation, high blood pressure, worsening heart problems, or even poor memory. Correcting what is causing one problem might well give you improvements for several of the problems that frustrate and concern you. And that's what this show is all about, and that's what we're all about at Life Celebrating Health in Humble. Feel free to ask for a consultation with one of our treatment assistants. Just dial 1-800-FIX-PAIN. You're listening to Feeling Better Naturally with Dr. John Trowbridge. And remember, we also depend on you to invite your family and friends to tune in and join us here on Star 790 KBME for the best medical updates ever, Saturday mornings from 6 to 7. Now, we're bringing you another patient today who is also a national champion-level athlete, Gary Robin, who's from Vidor, Texas, and came to see me with another tragic injury. Gary, welcome to the show.
Hey, Dr. Trowbridge, how are you today?
Doing great, thanks. Appreciate having you here.
Thank you, man.
So tell us what story got you in trouble?
Back in 1987, I snapped my anterior cruciate ligament and tore up about 2/3 of my cartilage, messed up the femur, and just generally tore my left knee up pretty bad.
Yeah, that's just about all the parts, isn't it?
Yeah, pretty well.
What happened?
I was on a dead sprint after a ball and basically went to the air to try to kick left-footed and I struck the ball well, but when I came down, my cleats caught, and it was just a freak accident. My knee twisted and snapped all the parts inside of it.
Now, you were quite a soccer player back then.
Yeah, I had accomplished a few things. I won a state championship, played on national level, and actually had played internationally a couple of times.
And this kind of looks like not a good picture for continuing to do that.
No, it pretty well take you out of your game. You're pretty well shot for life after that.
So what happened then?
I had surgery and was able to come back and play, but it never was quite the same. And as time progressed, it just got worse and worse. And I sought the advice of other orthopedic surgeons, and actually had a couple of more surgeries on the knee. And it got to the point where I couldn't even really sit down without pain. If I sat with the knee bent, it would hurt. If I stood up, it hurt. If I walked, it hurt, and it would go out on me. It was just a bad scene. It really was a really bad scene.
Did you ever find comfort lying down, sleeping, anything like that?
No, never. It was always a constant problem.
So what happened?
Well, I found out about your reconstructive therapy, and I said, well, I've exhausted just about everything else I can do for this knee, so I'm going to take a chance and give this a shot because I had a burning desire to play the sport again. I really love it. So
this is about 10 years after you got injured, right?
Yes, it is.
So you went through everything that conventional medicine has to offer.
I had exhausted everything. As a matter of fact, I saw some of the best surgeons that there are in this area, which would make them the best surgeons probably in the world.
They're pretty good around here, that's right.
Yes.
And at this point, had anybody talked about maybe an artificial joint that would allow you to get back to play, or any option to get back to play?
No, they actually told me that I was going to be a good candidate for an artificial joint without playing. They told me I'd probably have one when I got into my 50s. It would be something that I would have replaced.
Ouch.
Yeah.
So where do we go from there?
Well, we start reconstructive therapy with you.
That was a good start.
Yes, it was.
You know, I remember you asked me, could you get this knee good enough for me to go back to real intensive sports? And I recall saying, I probably could, but you wouldn't want me to. And you said, why? And I said, because you have torn this up so badly, it's going to be uncomfortable, lengthy, and expensive because of, you know, we're talking about rebuilding a knee from the outside when surgeons haven't been able to do it from the inside.
Yep, that's true.
And what happened?
Well, we started the first round of reconstructive therapy and went through it, and I noticed as time progressed up to about the 15th treatment that we were at a point where I could get back out on the field and actually do some things. I was actually starting to play in goal, which wasn't my normal position. My normal position was out in the field itself. But I was able to do things that I was amazed. After about 10 treatments, I mean, we're talking about a really bad knee here, guys.
Right.
And
we're talking really intensive soccer.
We're talking, yeah, we are. And I was amazed that after about 10 treatments, I mean, the pain was gone. There was no more gravelly feeling to me. There was no more not being able to rest at night or being able to walk comfortably. And after 15, we were getting into being able to do things again. Really, you know, to have some semblance of life again.
You know, that's kind of neat because what you're talking about is returning to play during the time that we're treating with you.
Yes.
Not sometime later after a lengthy rehab program.
Yes.
That's a whole different notion with reconstructive therapy, is that we want you walking and working with it so that we find where are the areas of weakness that need to be strengthened for you, because we're treating you, not your knee.
That's right.
So you started back on the field.
Yep, I started back, and as the treatments progressed, I'm kind of a different person. I kind of took liberty to push it a little bit further every now and then, so I would go out in the field and play a little bit, and of course exercise on the side to do more things to strengthen my knee per your program. And the next thing I know, we got into the treatments that were in the 20 numbers, and hey, I'm back on the field and I'm playing again, and ecstatic at that point because I never thought I would again.
That's just outstanding. Let me take just a brief pause. You know, we sometimes forget that spiritual centering is an important part of healing, getting better and staying healthier. Today's verse is from Proverbs 17, verse 17. Friendship is a strong and habitual inclination in two persons to promote the good and happiness of one another. And this is the season to renew and refresh your friendships. So remember that as we go through all the hectic commercialism of the Christmas season and as we draw this year to a close, this is the time for friendships. Gary, let's talk about what you're doing now. How is your performance at this point?
Oh, I can do anything I want to do. I can play without pain, no problems. I can run up and down the field. It doesn't matter. I can torque the knee, same as I did before. It'll handle anything. It's basically the same as it was before I tore it up.
What about swelling? Now, wait a minute. You're talking about since before you tore it up in 1988.
I'm talking about since I tore it up. Yeah, it's without swelling, without problem, without complication. It performs. It does well.
15 years and 3 operations later?
Yes.
And it was not the operations that produced the result.
No, it was not.
You know, the thing about operations that's kind of interesting is that when surgeons go in, they're either, tacking something down or putting something new in, new plastic or new steel, or taking something out. And the difference with reconstructive therapy is we're telling your body, here's the area that's been damaged or injured, and here's where you should do the healing. And that's the neat thing, is that you're healing naturally. What do you do now that you are fearful of in terms of activities?
Absolutely nothing. There's nothing I can't do as far as my knee goes. I don't even think about the knee, to be honest with you. When you talk about fearful, there's not a thought in my mind. It's like when I walk out on the field, well, what about my knee today? Or, if I'm going to water ski or whatever, I don't worry about my knee at all. It's good. It's fine. Matter of fact, I think that knee's better than the other knee. We'll probably start RT on the other knee.
So there's no hesitation.
None whatsoever.
And you've not really told us a lot except just dropping that little hint about water ski, but you've been kind of an outdoorsman all your life.
Yeah, pretty well.
Pretty strenuous stuff.
Yeah, very strenuous.
And this soccer was just something of a passion to get all that excess energy taken care of.
Yeah, well, he had to do something with it. It would be either that or something outdoors. I kind of grew up in the outdoors.
Yeah, I'm sure people are curious. How old are you now?
I'm 45.
45. So you injured yourself when you were 30.
Yes.
Which is the time when most people are thinking, hey, sports are just now getting fun because I don't have to be too serious about it. But you were serious about it. You were playing national, international level.
Yes, at 30, yes.
And then suddenly you're taken out of your game.
Yes, completely.
Don't I recall this last spring or winter that you were telling me you played 57 minutes out of a game?
I actually played 90. We played a tournament, to be honest with you. We played a tournament in Baton Rouge, and actually made it through 4 games that weekend, and never had a problem with my knee. The minutes are limited, though, in those tournament situations, but that's 4 games over 2 days. So.
4 games?
4 games, yes.
On a knee that had the surgery?
Yes.
And no problems. That is just absolutely wonderful. I had a fellow come in to get his knee treated. He was not an athlete like you, but I'm in the middle of treating his knee. He says, Doc, he says, I came up the stairs to see you today. And I said, well, that's great. He says, no, you don't understand. And I said, well, what is it? And he says, I don't take the stairs. And I said, well, I know. We've talked about that limitation. And he says, no. He says, you don't understand. Okay, I give up. What is it? He says, I came up the stairs because I was walking up the stairs thinking of the things that I had to do today, and suddenly it struck me, you don't take the stairs. He had guarded his knee for so long, always looking for, elevators and other ways around things, because that had been in his attention to protect that knee. And he says, today I just came into the building. I needed to get up to the second story. I just turned onto the stairs, and all of a sudden, oh, my God, I'm on the stairs. So it's kind of nice to hear you give the same idea that you don't worry about limiting or protecting that knee.
I don't even think about it.
So in the future, if you were talking about treating the other knee, if you had an injury, would you first go to surgery?
No, there's no way I'd go to surgery. My first thought's RT. I've seen it work on other people, and personal experience, it's the only path to go. If you're talking about putting stuff back in to make your knee right again, or make whatever joint it is that's injured right again, so that you can perform, not have to live to a lower standard.
I'm going to put a little plug in right away for surgery because, there are certain conditions where surgery is the proper first step. So the first thing you always do is diagnosis. And if someone like me who has a wonderful treatment like RT says, hey, you need surgery, then you need to seriously consider that. Gary will be back with you in just a couple of minutes. It's now about 45 past the hour here on Star 790 KBME, the best medical updates ever. For your better health, I'd like to share with you this special information from the Arthritis Trust of America. Now, I'd like to give you an informational story. This is not about osteo or degenerative arthritis, but about rheumatoid arthritis. There was a Dr. Blount practicing in the South. He was bedridden and drug and alcohol-ridden thanks to the pains of his rheumatoid arthritis, and no longer practicing because of the scourges of rheumatoid arthritis. He read an article that another doctor had written regarding some treatment that had been discovered in England using some recommended drugs, but no drug company here in the United States would make them available to him. And therefore, on looking at the chemical structure of different drugs, he kind of discovered one that was similar to the one that had been reported to him. He got himself and some older patients well on using this drug called metronidazole. He got well enough, he reopened his medical clinic and became known throughout the United States for treating and bringing great relief, often permanent relief, to more than 17,000 patients, including the current executive director and secretary of the Arthritis Trust. Now, you have to realize that there is a different disease process going on here, rheumatoid arthritis, and when we talk about one drug, we're talking about something simple, but it's not always that simple. However, the Arthritis Trust, through more than 200 physicians in the United States, offers this solution for those suffering with rheumatoid problems and a consistent remission rate of about 80% of the patients. I've been on the medical advisory board since 1995 and offering this treatment since 1983. Again, something for you to consider when you're thinking about rheumatoid arthritis. You may join them at their website, www.arthritistrust, that's all one word, arthritistrust.org. Today's celebrity birthday, Ira Gershwin, composer for wonderful Broadway songs that just are planted unforgettably in our hearts. And incidentally, we just missed Walt Disney's birthday, which was yesterday. Gary, when we talk with someone like you, the question comes up, are you just exceptional? Because you said, well, let's go ahead and let's treat this knee because I want to play. Are you exceptional? Are you someone who can just grin and bear it and gut it out?
I don't think I'm any more exceptional than anybody else. I think my pain tolerance is about the same, maybe a little bit more elevated because I'm an athlete, but I don't think it's anything that anybody couldn't do. This is RT. Anybody can do RT.
And indeed, you've seen little old ladies and young folks come in getting treated.
I've seen every age group come into your office to be repaired with RT and tolerate the treatments very well. It's not anything to it.
There's not anything to it. No. Remember, I'm an RT patient too. I tell people, that what we're doing is non-surgical and it does make a difference, but it does indeed have some discomfort associated with it. And it's just that the treatment results are so much worth it and so much less than a problem with surgery. You've had 3 surgeries, right?
Yeah, I had major surgery the first time, and after that it was arthroscopic surgery. I will say this much: the last surgeon I talked to that looked at my knee that also had told me that I would be a knee replacement candidate in my 50s, told me that the only thing that they could do for me anymore was to take things out of my knee. And they couldn't do anything more for me as far as helping my knee. We were just going to go in and take stuff out. So.
And that was the beauty. God knew how to put the instructions inside so you could put things in, rebuild yourself. And Gary, thanks so much for sharing your story with us today. We appreciate your joining us.
Thank you, Dr. Trowbridge.
You bet. All right, so what's the take-home message today from our 2 guests? Well, arthritis is a deadly disease when it takes you out of your life. In other words, when it takes you away from what you literally live for, the activities that give you joy. And the message of hope is that RT, reconstructive therapy, a non-surgical treatment with no daily drugs, can help 80 to 90% of the arthritis patients resume much more normal lives, usually pain-free. But what if you are, in fact, a sports hero? RT has shown, as Mark and Gary described, the ability to restore even optimal function, quickly returning national champion-level competitors to their exceptional performance, even after disastrous injuries. So if your problems are just as serious for your life, although not perhaps as disastrous as the ones we've described today, or if you've been advised to have joint surgery, even an artificial joint, you owe it to yourself to check out RT, Reconstructive Therapy. Now, do you know a professional sports hero? You'd be surprised how many of them don't know that RT could help them now. Please let them know to call us at 1-800-FIX-PAIN today, because you see, the real hope is that help is really available now. Ron, who called from Alvin, inspired today's show. And today's program of Feeling Better Naturally with Dr. John Trowbridge has not been brought to you by the number 7, has not been brought to you by the letter M, but instead has been brought to you by the book, Do What You Want to Do. Now, this is a book that my friend and mentor, my trainer, William Faber, a doctor in Milwaukee, who taught me how to do reconstructive therapy, he's my doctor. He's the one who treated me and got me going again in my life. We put together personal success stories with non-surgical reconstructive therapy. And we talked about neck pains and headaches, back pains, arthritis, other joint pains, and even nerve and tissue problems. Dr. Faber wrote a book that first introduced me to reconstructive therapy and what it could gloriously do to inspire natural healing, with a book called Pain, Pain, Go Away. A great title, and it was released, I believe, in 1990, and has since then shown many, many patients what they can do to feel better. This book, Do What You Want to Do. Get pain relief now with no daily drugs, no surgery, heal naturally, and get stronger, is a marvelous little book that we put together with patient stories, and two of the best patient stories in here are the ones Dr. Faber and Dr. Trowbridge. Those are the patients. And we have both had such dramatic results with reconstructive therapy. Now, let me give you just a quick refresher on what this is all about. And I think it's important for you to get the idea down pretty simply. We're made of bones and bands. That's our framework. And that's what gives us strength to move around. That's what allows us to function. And when we function well, we bend and reach and walk and so on. We do this with ease. Now, if your bones and bands are injured, you have a problem. And usually with bone injury, you have a surgical problem. And indeed, that's why Mark, who joined us earlier, had to have surgery on his ankle. He had a rather substantial injury to his bone, cutting off the blood supply. And he had substantial injuries to his bands, the ligaments that he talked about needing repair. But after this injury and after this repair, he still had that wobble. The joint was not supported well enough, and that decreased the strength in that neighborhood. His ankle, a critical part, that's why he was limping around. If you decrease the strength, you decrease the function, or you eventually get what are called malfunctions in the area, and then you start developing disease. In other words, it's no longer easy for you to bend, reach, or walk. Usual medical care starts at this point when you notice significant symptoms, joint pains, muscle spasms. If it's in your neck, you have headaches, or you get stiffness in the joint, swelling, numbness. You can have nerve pains, lost sleep because you're uncomfortable, you get irritable, and you have obvious limitations. Now, your choices when you present to the physician with symptoms like this are drugs and surgery, or reconstructive therapy. If you get drugs, that's often the nonsteroidal anti-inflammatory medications, and those can be a problem because what they do is block the healing. In other words, inflammation is the first step in healing and repair. And if you block the inflammation step, you don't get full healing, you don't get full repair. If you get surgery, often they're tacking something down or taking something out, smoothing something around, and that can still lead to more and more wobble on the inside. So your symptoms progress to crisis. In neck problems, people get fusion, same with the back. In hip problems, they get a new hip. Of course, it's not new you, it's new plastic and new steel. Same for a knee or an ankle. You get fusions or new replacement joints. You get more and more drugs and surgery, or you still have an option to consider reconstructive therapy, RT. The important thing about this is that what we're able to offer you, in other words, is a real opportunity to regrow yourself. And when we talk about regrowing yourself, what we're talking about is people actually getting better with what's going on in their lives. And when we talk about getting better, we're talking about healing from the inside out. You know, one of the problems that people have when they have fusion surgery is that there's greater stresses on the joints above and below, because the one in the middle is no longer working to carry its part of the load. So, for instance, if you fuse an ankle, as they had proposed for Mark, you get more problems with your foot, more with your knee and hip, and so on. When people get neck or back fusions, the discs above and below this area now have fusion, or now have more demand placed on them, which means they too begin to degenerate more, wobble more, they degenerate faster. And this is one of the reasons why people get more operations. You hear of someone getting a fusion, and then the next thing you know, they're getting another fusion operation. These things are significant because what they do is take away opportunities in life. And those opportunities are pretty significant because when you lose opportunities for yourself, those are your life days that we're talking about. And when we talk about do what you want to do, this book shares with you many patients who have had those opportunities restored in their life. They got out of their pain and were able to get on with their life. So the message today with reconstructive therapy and degenerative arthritis is one of hope, one that gives opportunities for people to go on with their lives. You know, next week we're going to share some other special features with you. You've heard the term tension, pressure, pain. And how do you spell relief when there's none in sight, day after day, week after week, month after month, even year after year? Many of your friends and family are suffering from this all too common malady, taking them out of their lives, not with their joint pains, but with something else. So find out how you could help and the book that you could read about what might be the ultimate therapy for this problem of tension, pressure, pain. Today's show is dedicated to the wonderful staff who make Life Celebrating Health a phenomenal place for healing. Half of these wonderful young ladies have been with me for 8 or more years. The others are on their way. 2 of them have been with me for more than half of my 25 years in practice, and they are the key to our patients' successes. And ladies, this show's for you. You know, it's a great pleasure to join you on the radio to talk about what we do, but what we do is more special outside the office than inside, because what we do is out there in people's lives. They're leading it every day. They're making wonderful things happen for themselves, and that's the whole purpose of health care as opposed to just illness care. And we're glad that you've joined us to learn more about what you can do for yourself. Our production engineer today is Mark Fisher. Production assistants, Catherine Hill, Kathy Guyan, and Rhonda Bird. Thanks for joining me today to learn more practical pointers that can help you regain and maintain better health. Audio tape and CD copies of this show are available for your personal reference and to share with family and friends. Simply call 1-800-FIX-PAIN, F-I-X-P-A-I-N, for details. I invite your feedback. What do you want to hear more about? What questions do you want answered? Who would you like for me to interview, and what questions do you want them to answer? Please share your ideas by email. That's info, I-N-F-O, at healthchoicesnow, that's all run together, healthchoicesnow.com, by fax at 281-540-4329, by mail, call 1-800-FIX-PAIN for the address, or feel free to call to talk with one of our treatment assistants and let us know what you want to hear, what information we might send you. Receive our free e-newsletter simply by sharing your email address with us, and enjoy the free downloads available on our website, www.healthchoicesnow.com. Feel free to come by and see what's so special and talk with patients who are feeling better right now. We're conveniently located next to Northeast Medical Center Hospital near Bush Intercontinental Airport. Call 1-800-FIX-PAIN for directions, or we'll send you a map. We'd love to show you where better health happens. Remember, if your money, your time, your effort, your comfort, or even your life is at stake, get the very best answers and the very best treatment you can find. Rely on experts who can make sense out of your problems and who have the experience to produce results for you. When life is your choice, failure is not an option. Our message is one of hope for a healthier future, and we aim to produce these results for you. Invite your friends and family to join me next week, Saturday morning from 6 to 7 on Star 790 KBME for the best medical updates ever, exclusively on Feeling Better Naturally with Dr. John Trowbridge. Have a great day and a wonderful week.